Hi, this is Dr. Gary Sykes. I'd like to talk to you now about the differences between public and private pregnancy care. More people are turning to the public system because of the huge financial strain many people are feeling these days. The public system is extremely different to the private system, and people are turning to the public system without realising these differences. The differences can be summarised in three words. One is choices, the second is risks, and the third is relationship. Choices. If you elect to go public, you won't be able to choose which public hospital that you go to. You'll be required to go to the public hospital of your area where you live. You may have heard bad reports about that hospital and want to go somewhere else. That doesn't matter. That's a system. So you have to book in at that hospital. Now, when you do book in, you will not have a choice as to who looks after you. You'll be expected to be seen by the hospital staff. You'll be primarily under the care of the midwifery staff. So you'll be primarily looked after by midwives, student midwives, if need be, by junior doctors, by trainee obstetricians, we call them registrars. And it's very unlikely that you'll ever see a fully qualified specialist obstetrician on your journey. What that means is that the people who are looking after you have got limited training and limited experience. Now, you will probably not have any great ability to choose about delivery. I have patients who want to have a cesarean section by choice, patients who want to be induced and want to be induced a little bit earlier than their EDC. These options are usually not available to you as a public patient. Now, when you stay in the hospital, it's more than likely you'll be given a shared room. You won't have a choice. Your partner will not be able to stay with you. If that's the case, you'll have to share a bathroom. If you want to stay a little bit longer, again, that's not usually possible. You'll be discharged sooner than you would prefer if you prefer a longer stay. In the private system, you choose the obstetrician that you want to go to. You choose the hospital according to where the obstetrician is booked. It's that obstetrician that manages you in the pregnancy, your stay. You have a choice as to the options of delivery. In accord with risks, the obstetrician will discuss that with you, but if everything is okay, then certainly you can choose the mode of delivery. You can choose to have a longer stay. You will have a single room. Your partner can stay with you. So the choices are far greater in the private sector than in the public. Now the second word I mentioned was risk. With the private situation, you are managed by a fully qualified specialist obstetrician all the way. In the public system, you are managed by midwifery staff and junior medical staff if appropriate, if needed. These people have had less training and less experience. That means they're more likely to not see a potential problem soon. And also, if a crisis does happen, if there is a complication, because of their limited experience, they may not manage it as well. And so this can have huge implications for you and your baby. In other words, you and your baby, or you or your baby, could end up with all sorts of scenarios and adverse developments and adverse outcomes which would have been avoided if you'd been under the care of a fully qualified specialist obstetrician. The price is huge. I've had numerous patients, and I keep on hearing about more patients in the public system where they have avoidable complications which have ongoing implications for that baby for the future. The price they pay to save money, I don't think they think it was worth it. Indeed, I'm sure they don't think it was worth it because of the regrets that they now have about that choice that they made. The next topic is relationships. my patients, I endeavour always to build a relationship with them. They know I'm here for them, they know I want to care about them, they know I put them first. It's a relationship. They know that they can contact me anytime. They can contact me about all sorts of trivial things, but they're important to them. But if they're not in the private sector, if they're not seeing a private obstetrician, who do they contact? With the public system, you don't actually have a relationship. You don't have the continuity of care. It's highly likely that the people who look after you in the antenatal clinic will not be there in the labour ward. You'll not know the staff that turn up on the day. Decisions will be made by total strangers. That's spooky. It's frightening. It is very, very frightening for you because that is sadly the scenario. You don't get that say which you would have had in the private if you were a private patient. So you don't have the relationships. And as I said, patients can contact me between visits. In the public system, well, you would have to, I suppose, phone the birth unit, and the midwife would advise you. But she certainly wouldn't be interested in all sorts of questions I get. Can I use nail polish? Can I colour my hair? Can I have a pizza? You name it. I get so many different questions that people send through me, usually through social media, and I'm delighted to answer them and allay their anxieties. But that is not possible in the public system. So if you go public, then obviously your anxieties will not necessarily be allayed because you don't have that relationship with the staff of the hospital. Myself and my wife, my children, they're all married, and we were a couple last weekend. They're both pensioners. We're all privately insured. Even when our finances are difficult, we maintain our private insurance because we don't feel we can afford to take that huge risk, the uncertainties, the potential for disasters that can happen in the public system. So I would strongly recommend that you do go private rather than public. I'd strongly recommend if you're not insured, you take out private health insurance. If you are insured, you maintain it, you don't quit it, and you find it look at other ways that you can save money. Bye for now.